Could your body be sending warning signals up to a month before a stroke? And would you recognize them? That question lies behind this video's title, 1 month before a stroke, 9 red flags everyone needs to know. Before we get into the list, here's an important caveat. No single symptom guarantees a stroke will happen in exactly 30 days. The research on consistent, predictable 1-month warning signs is limited. Still, doctors and studies suggest that certain changes in the weeks or days before a stroke can be meaningful, especially when they happen together or in people with known risk factors. So listen carefully, take these signs seriously, and know what to do next. Imagine this. A 57-year-old who's always been active notices she's unusually tired. Then, one morning, her vision blurs for a few minutes. She shrugs it off. 2 weeks later, she wakes with a severe headache and some numbness in her left hand. That sequence won't always lead to a stroke, but it highlights how subtle symptoms can add up. I'll walk you through 9 red flags, what they look like, why they matter, how they might feel day to day, and when to see a doctor right away, versus when to monitor and call for an appointment. If this matters to you, hit like and share this video so more people know these signs. Number 1. High blood pressure. High blood pressure or hypertension is the single biggest controllable risk factor for stroke. Think of blood pressure as the force pushing blood against your artery walls. Over time, too much force damages arteries, making them more likely to clog or to burst. How might this show up a month before a stroke? Often you won't feel anything. That's why hypertension is called the silent killer. But some people notice headaches, a sense of pressure in the head, or more frequent nosebleeds. The practical step is simple. Check your blood pressure at home or at a pharmacy. If readings are consistently above what your doctor has set as your safe range, contact your healthcare provider promptly. Don't change or stop any medications without consulting them. If your blood pressure spikes very high suddenly, for example, if you feel intense headache, severe chest pain, shortness of breath, or sudden weakness, seek emergency care right away. Number 2. Unexplained fatigue. Not all tiredness is a red flag, but a persistent, heavy fatigue that comes on for no clear reason and doesn't improve with rest can be a sign something's off. This isn't the same as a long workweek slump. It's a change in baseline energy that interferes with activities you usually manage. You might find climbing stairs suddenly exhausting or struggle to concentrate on simple tasks. Why could this relate to stroke risk? Fatigue can reflect poor blood flow, heart problems, or metabolic issues like uncontrolled diabetes, all of which raise stroke risk. If you notice new, unexplained fatigue lasting several days to weeks, mention it to your doctor. If fatigue comes with sudden weakness, confusion, or trouble speaking, treat it as an emergency. Number 3. Vision problems. Vision changes are one of the more direct neurological warnings. That includes blurred vision, double vision, sudden partial loss of vision in one eye, or trouble focusing. Sometimes it's brief, a few seconds or minutes, and then it resolves. Even when it's temporary, that transient loss of vision, especially if it's in one eye or involves one side of your visual field, could indicate a transient ischemic attack or reduced blood flow in brain areas that control sight. If you experience sudden vision changes, stop what you're doing and sit down. If the change is sudden and significant, call emergency services now. If it's mild or brief but recurring, make an appointment with your healthcare provider within a day or two to evaluate it. Number 4. Sudden severe headache. Most headaches are benign, but a new, intense headache that comes on suddenly and is different from anything you've had before deserves attention. People describe it as the worst headache of my life or a sudden crushing pain. This kind of headache can be a sign of bleeding in the brain or a vascular event and warrants immediate emergency evaluation. That said, not every bad headache is a stroke sign. If you have a severe headache accompanied by weakness, confusion, trouble speaking, or vision loss, call 911 right away. For headaches that are unusual but not catastrophic, contact your doctor promptly for further assessment. Number 5. Numbness or weakness in the face, arm, or leg. One of the classic early warning signs involves sudden numbness, tingling, or weakness, usually on one side of the body. You might notice your smile looks uneven, your arm suddenly drifts down when you try to hold it up, or one leg feels heavy while walking. These lateral patterns, meaning one side more than the other, are particularly suspicious for problems in the brain's blood supply. If this happens suddenly, it's an emergency. Call 911 immediately. If you notice intermittent numbness or weakness that comes and goes over days or weeks, or that's milder than a sudden paralysis, contact your healthcare provider promptly to evaluate nerve, vascular, or cardiac causes. Number 6. Difficulty speaking or slurred speech. Speech problems can be subtle at first. You might have trouble finding a word, your sentences feel jumbled, or your speech becomes slurred like you've had a few drinks. Difficulty understanding others can also be a sign. Speech centers in the brain are vulnerable to disruptions in blood flow. If speech changes happen suddenly, or you or a loved one can't understand you, call emergency services now. If word-finding issues or slurred speech are mild, intermittent, or new and unexplained, schedule a medical evaluation within a day or two. Don't wait weeks. Number 7. Memory lapses or cognitive changes. Many people worry about memory, and not all forgetfulness points to stroke. Still, sudden or progressive changes in attention, short-term memory, or the ability to perform routine tasks can be a red flag when they're out of character and unexplained. Some studies have found associations between cognitive changes and higher stroke risk in certain groups, which suggests memory problems can sometimes be an early warning sign, especially if they appear together with other symptoms like confusion or difficulty speaking. If you notice unusual memory lapses, episodes of confusion, or trouble following familiar instructions over days to weeks, tell your doctor. They may recommend cognitive testing, imaging, or cardiac evaluation to check for causes that can be treated to lower stroke risk. Number 8. Loss of balance or dizziness. Feeling unsteady, experiencing sudden dizziness, or having trouble walking in a straight line can stem from inner ear problems. But they can also be signs of central nervous system issues, including impaired blood flow to areas that control balance. Pay attention to whether the dizziness is accompanied by other neurological signs: double vision, weakness, numbness, slurred speech, or difficulty coordinating movements. If imbalance or sudden severe vertigo comes on with those signs, seek emergency care. If you're having recurrent dizzy spells or a persistent sense of imbalance, schedule a prompt medical appointment to evaluate heart rhythm, blood pressure drops, or neurological causes. Number 9. Nausea and vomiting. Nausea and vomiting alone are often from gastrointestinal causes, infections, or medications, and most times they're not a stroke sign. But when nausea or vomiting occur with other red flags, dizziness, severe headache, trouble speaking, vision loss, or sudden weakness, they can indicate involvement of the brainstem or cerebellum, areas that, when affected, can produce these symptoms. If vomiting appears suddenly along with any focal neurological symptoms, call emergency services. If you have unexplained, persistent nausea and it's new or unusual for you, mention it to your clinician as part of a broader symptom review. Here's a useful way to think about action steps across these signs. If a symptom is sudden, severe, or involves weakness, slurred speech, facial droop, or loss of vision, treat it as an emergency and call 911 or your local emergency number immediately. If symptoms are new but milder, transient, or recurrent over days to weeks without dramatic change, contact your primary care provider or a neurologist promptly, within days, not months, so proper evaluation and testing can be arranged. Now let's step back and consider the context, risk factors that raise the chance that these early signs could herald a stroke. High blood pressure, smoking, diabetes, high cholesterol, atrial fibrillation or other heart disease, obesity, a high-salt diet, sedentary lifestyle, older age, and family history all increase stroke risk. These factors don't guarantee a stroke, but they make warning signs more concerning. For example, a brief episode of vision loss in a young, healthy person might have a different likelihood than the same episode in someone with uncontrolled hypertension and diabetes. That's why it's important to view symptoms together with personal risk. What can you do right now to lower risk and improve early detection? First, monitor your blood pressure regularly. Many people can check at home with an automated cuff. Keep a log and share it with your healthcare provider. Second, manage chronic conditions. Talk with your doctor about blood sugar control if you have diabetes, and get routine checks for cholesterol and heart rhythm if you're at risk. Third, lifestyle changes matter. Aim for regular physical activity that fits your ability. Reduce sodium and processed foods. Focus on a diet rich in vegetables, fruits, whole grains, and lean protein, and prioritize healthy weight. If you smoke, seek help to quit. Cessation is one of the most effective ways to lower stroke risk. Limit excessive alcohol intake and try to keep stress and poor sleep under control. Finally, keep up with scheduled medical visits and ask your clinician whether further testing, like imaging or heart monitoring, is appropriate when symptoms arise. Some practical monitoring tips. Carry a small notepad or use your phone to record episodes. What happened, how long it lasted, and any accompanying symptoms. Note triggers if you see a pattern. If you have an irregular heartbeat or palpitations, mention them. Atrial fibrillation is a treatable heart rhythm problem that can significantly increase stroke risk. If you have transient ischemic attack, TIA, symptoms that resolve, don't assume you're in the clear. TIAs are important warnings and should prompt urgent medical evaluation to reduce the risk of a full stroke. You may have heard of FAST as a fast way to remember emergency signs. Face drooping, arm weakness, speech difficulty, time to call emergency services. That's still an excellent rule of thumb. Some clinicians add BE to make B fast. Balance, sudden loss, eyes, vision changes, face, arms, speech, time. Use whatever version helps you act quickly. The bottom line is, sudden facial droop, sudden arm or leg weakness, sudden slurred speech or confusion, sudden severe headache, or sudden vision loss, call 911 immediately. Let me close by recapping the 9 red flags. 1. High blood pressure. 2. Unexplained fatigue. 3. Vision problems. 4. Sudden severe headache. 5. Numbness or weakness in the face, arm, or leg. 6. Difficulty speaking or slurred speech. 7. Memory lapses or cognitive changes. 8. Loss of balance or dizziness. 9. Nausea and vomiting when paired with neurological signs. Remember the scientific caution. These signs do not guarantee a stroke will occur in exactly 1 month. Evidence for a fixed 1-month window is limited. What matters is that these symptoms, especially when they occur together or in people with risk factors, are signals that deserve medical attention. If any of these signs come on suddenly and severely, call emergency services. Call 911 without delay. If you notice milder, new, or recurrent symptoms, schedule an appointment with your primary care doctor or a neurologist within days to get appropriate testing and follow-up. Check the description below for links to reputable stroke foundations, BP monitoring guides, and resources to help you talk with your clinician. Take a moment now. If this video could help someone you care about, a spouse, a parent, a neighbor, share it with them. And if you want more clear, practical health guides like this, subscribe to the channel and turn on notifications. Your vigilance could make the difference between early treatment and a crisis. Thank you for watching. Stay attentive to changes in your body and don't hesitate to seek care when something feels wrong.